And repeating the message in question time there, Kieran. So Scott Morrison saying in clear terms today that once we get to 70 to 80% vaccinated, we have to live with the virus without lockdowns as we hit 818 new daily cases in New South Wales and 71 new cases in Victoria today.
The national plan we have developed and agreed is our pathway to living with this virus. That is our goal, to live with this virus, not to live in fear of it. It is a plan based on the best possible scientific, medical and economic advice. Once you get to 70% of your country that is eligible for the vaccine and 80%, the plan sets out that we have to move forward. We cannot hold back, and we must adjust our mindset. Cases will not be the issue once we get above 70%. Dealing with serious illness, hospitalisation, ICU capabilities, our ability to respond in those circumstances, that will be our goal. Because if not at 70% and 80%, then when? Then when? We must make that move. Otherwise, we stay in the cave forever. And that's not a sustainable solution.
Amongst senior Liberals who have been urging the PM to muscle up to the states are those seen as leadership rivals, Josh Frydenberg and Peter Dutton. But when our reporter Jonathan Lea put the PM on the spot as to would he put the federal government money where his mouth was on this, in terms of supporting the states to pursue lockdowns after those benchmarks were reached, the PM wouldn't commit.
We've already seen Western Australia suggest that they're prepared to continue with COVID zero. We've seen Queensland, as your Minister Karen Andrews has said this morning, crab walking away from the deal. Are you prepared to show the fortitude and turn off the money tap if they don't open up the borders?
Very committed to the national plan. And I tell you what, I think Australians are too. I think 7 to 8 out of 10 Australians who've taken a decision to go forward, get vaccinated, endure these lockdowns, do what's been asked of them, I tell you, they'll be expecting that plan to be put in place. And I think the voices of Australians on this will be very critical. So let's just see what happens.
If not, then when, the PM says, in terms of 80% vaccination and reopening. He has a sympathetic audience in New South Wales and Victoria. But what about the rest of the country? Just 2 months ago, just a couple of days after an aircrew driver in Sydney who was not required by the New South Wales government to be vaccinated or masked had begun spreading the virus, the Prime Minister gave me an interview in Paris on his G7 Plus trip. In Paris, we had to wear outdoor masks and there was a curfew every night after 11 p.m. The Prime Minister told me during that interview on June 17 of the difficulties in opening up with a heavy caseload and how we were so much better placed than other countries. We've all been over here with you and seen another world, really, what living with the virus is like. What's your impressions of all that, of what you've seen?
It confirms the view that I've often expressed when we've been home. And that is, in Australia, we're living life during COVID like few, if any, other country around the world. And we've had quite a bit of a glimpse of that here, whether in Paris here today or in the UK over the course of the weekend. I mean, the rest of the world is carrying a load when it comes to the virus and the pandemic, which is extremely heavy. And the decisions that they're making, just like the Prime Minister Johnson has had to make just most recently, I think continues to highlight the uncertainty of the pandemic. And that means that even though there is much we do know now about the virus, there is still a lot we don't. And that means we need to continue to be cautious to protect lives and protect livelihoods, as Australia is doing. UK, indeed, a country with almost 80%, well over 70% of their population vaccinated, but yet still having those very significant challenges. It just goes to show that there's no one thing.
At this time, UK Prime Minister Boris Johnson, because of the Delta variant, had just delayed Freedom Day as cases grew in that country from 3,000 to 10,000 a day. There was more than 70% single-dose vaccination and 56% double-dose vaccination in the UK at that time. The Director of Epidemiology of the Doherty Institute, Jodie McVernon, made clear to me on Sunday Agenda that her modelling which set that target of an opening at 70 and 80% vaccination, was modelled on a basis of a low caseload, and modelling was now going on for New South Wales Health in terms of what happened at a higher caseload. Can we talk about a situation where we get to 80% double vaccination and what New South Wales would look like if it had cases in the thousands by then?
So I think it's important to differentiate between what our report is discussing, which is making a transition from a state of no or very few cases into a more immunised environment, and then thinking about how transmission might be managed there, as opposed to coming down off a high caseload. So clearly vaccination is going to be a critical tool to augment the public health response in New South Wales, but our report doesn't specifically address that case.
Now, Scott Morrison has got 23 seats in Queensland and 23 in New South Wales. And they have to be on his mind as he makes this statement about opening up unequivocally at 70 and 80%. In New South Wales, they want an end to lockdown. In Queensland, they would want zero COVID. What a political juggle ahead of what promises to be a tight federal election in the first half of next year. From what I'm hearing, there won't be a big freedom day in Sydney or Melbourne, but restrictions will be lifted steadily as the vaccination rate goes past that 70 and 80% mark. Even Victorian Premier Daniel Andrews pointing to this today rather than talking about zero COVID.
The national plan is very clear. At 70%, less likely. 80%, and I know it's only 10 points above the 70, but it is meaningful. It's really meaningful. That's what the Doherty modelling tells us. I think it is highly, highly unlikely that we'd have anything like a statewide lockdown.
Now, here's the fly in the ointment for opening up. Kids. The government, as I have reported, are looking to do a vaccination blitz in late October for teenagers, once ATAGI approves it for 12 to 15-year-olds. So if you have high school kids, you have hope of getting them back to school this year in Sydney in particular. You have hopes of them not being at risk of long COVID and the like. But if you have primary school kids, it's probably a case of forget it for the rest of the year for school, despite New South Wales Premier Gladys Berejiklian saying it was too early to tell people what was happening today. Everything from this evidence of Kerry Chant, the New South Wales Chief Health Officer, at budget estimates hearings today suggests it's just too risky to send unvaccinated primary school children back to the classroom.
Is there any chance that children will go back to school before they are vaccinated, given these current increased risks of the Delta virus?
We have not concluded our firm thinking. I think it's pleasing to know that the vaccine, ATAGI is currently considering vaccination for 12 to 15-year-olds. ATAGI needs to make that decision. But I suppose what I'm trying to say is I just want to give optimism to parents, particularly for the high school students, that I do understand that it is likely that is more likely to be in the short term. I think we need to achieve as quickly as possible very high immunisation coverage, and I believe also that it does need to be across all age groups. I think it is important to understand that there are a number of factors that feed into risk, and it is around the case numbers of the community as well as any inherent risk in the children.
Dr Chant's made it pretty clear in estimates this morning that vaccinations are very important for kids to return to classrooms, and also said that primary school aged kids probably aren't going to get vaccinated this year. Does that mean this week you're going to stand up and tell us that primary school aged children are not going to return to classrooms this week?
No, look, it's really important for us to make sure we are able to communicate as soon as we can to the public about what school looks like for the rest of the year, and we intend to do that hopefully by the end of this week. But there's no doubt that obviously vaccinating the senior adolescents is key to this, and that's why some weeks ago we started the process of vaccinating high school students in those local government areas of concern.
So you could have nail salons and pubs open, but not primary schools. It's a sad state of affairs, but it is what it is. I'm also told the situation in Wilcannia, in the remote far west of New South Wales, is not good, with more and more COVID-19 cases emerging there with unvaccinated people.
I already know from 8 p.m. last night to this morning, there are already 15 new cases that we're concerned about the far west, and that would include Wilcannia.